Hello and welcome to episode 114 of Tom's Hirschsprung's podcast. I'm very glad to be joined this morning by Charlie. Morning, Charlie.
Hi, how are you?
Thank you so much for coming on. And we're going to talk through Teddy's Hirschsprung's, well, his journey thus far.
Yeah.
I guess we'll kind of start where we usually do, sort of from the beginning, if that's okay.
Yeah, of course, yeah. Teddy's my second child, so no history of Hirschsprungs in our family at all. We've got a little girl, Thea, she's 8. So she was 5 when he was born, relatively normal pregnancy. I think one thing that I've always wondered is he had a lot of hiccups, like towards the last kind of weeks, and obviously Dr. Google and all that you see, and it's like, well, maybe just check, there might be a little bit something going on. But midwives and everything were really, were fine, and everything was fine. Labor as normal as any labor can be. But yeah, he came out fine. He did his first poo, everything that you're expecting of a newborn baby. We were signed off to go home. And nothing kind of untoward really the first couple of days. He was quite a mucusy baby, but it wasn't everything that we kind of hear, from Hirschsprung's really. It's like the green, the bile. It wasn't like that initially. It was quite excessive. I think the first night in hospital we had to change his bed a few times, but it was brown. Obviously my second baby, so I knew there's a bit of mucus that can come out of newborn babies and stuff, but it did kind of drag on a little bit. And then the only things really of note was he was quite a sleepy baby. He didn't feed as much, so there was always felt like there was a little bit of pressure there. He was breastfed, so it was always a bit like I think maybe our daughter, she had been like quite a full-on baby. So maybe we just thought, oh, maybe this is just calmer. We've got a chilled baby, sleeps more, eats, a little bit less. But then I think it was on the 6th day, we he just hadn't eaten for quite a while, and you thought, certain amount of hours, certain amount of window, that's when to get concerned. We went to our GP, kind of checked him over. He was like, he's presenting well. Like the only concern is that it's been a bit of time now since he's eaten, and obviously he's so young. So he sent us to our local hospital, and again, they just kind of put us in a room, encouraging us to feed, and he just wasn't, bothered. At one point, he did, you know, cough up a little bit, and I kind of caught it on the muslin, and that was that kind of bright green, and I was a bit like, that's, not good. But I was glad I caught it in the muslin. Keep it, show the doctors. Um, Ultimately, they kind of transferred us to kind of the baby ward, and they tried with an NG tube, with some expressed milk. It just, it would he would take a certain amount and then he would just kind of vomit. Um, Lots of doctors kind of in and out that night. He went for X-rays, and then ultimately, kind of early hours of the morning, they said, "We're not sure what's going on. There seems to be." Can't remember whether they said it was like a mass or a blockage or something in the kind of bowel area. Um, we're going to talk to Alder Hay, which is our local kind of children's specialist hospital. And they essentially said they wanted to see him. So alarm bells kind of ring then, because Alder Hay is a very special hospital for very poorly children. And we were like, why is our baby, going there? I remember phoning my husband and saying they want us to go to Alder Hay, and I just remember hearing him go, "Oh no, what's wrong?" Um, so I had to get a very special ambulance with a very special, kind of baby box to put him in. And so I just remember kind of walking out that hospital, kind of following this ambulance crew, just absolutely petrified, horrendous. And we got into the ambulance. My husband kind of followed, and it's a fairly short drive. I don't know, about an hour, to Alder Hay. And as we got out of the doors, I noticed and flashed in the window that the blue lights had been on the whole time that I didn't realize from being inside there. And I think the gravity of everything kind of suddenly, hit me. Um, but Old Hay was a really positive experience. We walked into the room, he was kind of taken, ahead of us. And as we walked into the room, it was just like doctors, nurses surrounded him. And I do remember feeling that kind of overwhelming feeling of we're safe here. He's in a good place. Um, and yeah, essentially they just hooked him up to everything, all that awful, pictures you can imagine with babies with wires and all sorts and not being able to kind of touch him. Um, he had various things. He had a contrast X-ray to kind of look at the upper part of his, insides, I suppose. Came back normal. They were like, we think maybe he's just got an infection. We're going to send you back to Glenclwyd, to your local hospital. And I was like, no, something wrong. Like, there's not, he wasn't feeding, he was just sleeping. Um, I was breastfeeding. I wasn't sure whether it was something I was doing. Am I poisoning him? Am I eating something wrong? Is he allergic to something? I was like, it was important to me to breastfeed, but I was like, give him a bottle, give him like special milk or do what you need to do, to make him feel better. I think there was one day when we just sat there. I didn't get dressed. I think I was in my pajamas the whole time. We were just staring at his bed because he just wasn't, he wasn't doing anything. He wasn't, waking up. Um, I was expressing milk, and then they helped me to try and feed him with the NG tube, and kind of, I remember holding it and kind of watching the milk go down, and then the milk would go back up, and then thinking, oh, he's taken a bit, and then just vomited everywhere. And we had a really amazing neonatal nurse. She really advocated for us. I was like, there's something wrong. The only reason we weren't sent back straight away is because they couldn't find the right ambulance to be able to transport him back safely, which kind of caused a little bit of a delay. I was like, we need to stay here. I was like, there's something, they don't really like, there's got to be, I don't know whether it's mother's intuition or just pure fear, but I was like, we need to stay here. And she really advocated for us, and she came back and there was a nurse practitioner on, and she was like, I've been racking my brains all day. She's like, I don't know what it is. What I'm going to do is going to have another x-ray on a different part of his, tummy. Bear in mind, he's a very small little tummy anyway. And the amazing hospital that Alderhay is, they wheeled this amazing x-ray kind of machine from nowhere that kind of came over his bed. They took an x-ray, and that's when they saw that a lot of the issue was kind of lower down. So they said, we're going to do a washout, a little baby enema, just see what's going on. And I remember feeling like, oh gosh, that's really invasive on a tiny baby. I didn't leave the room, but my husband kind of stood at the bed, and I just kind of was a little bit scared of it, I think. And they were like, whoa, explosive, like lots more meconium came out. A really kind of successful washout, as we'd kind of come to become, aware of. And he was like a different baby, alert straight away, ravenous, just fed then non-stop. We were like, he's fixed. Like, that was it. It's just a little bit of a blockage. Like, it's fine. And so, we had a great night with him, and then the next day expecting to be discharged, like, oh, that was it. Like, what a worry over nothing. And they were like, just because of the washout in it, and we think it's probably right we do a rectal biopsy. And the doctor said, and I said, okay. And he was like, it's to check for, we're looking for Hirschsprung's disease. And he goes, I'm 99% sure he doesn't have it. And he was like, don't Google it. And I was like, okay. So it just went over my head. And then I remember asking the nurse as he left, what was that he said they were looking for? And she says, Hirschsprung's disease. But she says, he doesn't think he's got it. Like, don't worry about it. And so we were like, okay. Okay. Anyway, the next couple of days, we couldn't leave because he'd lost quite a lot of weight. They were looking for, a certain amount of weight gain. And in the end, they let us go before the results came back. They said, if there's any issues, obviously let us know. But we left thinking, oh, thank God. Obviously, we've got our 5-year-old daughter at home as well, who's just wondering why everybody suddenly left after the newborn baby. So we got home that day, and he classic stopped pooing. We were like, bit concerned. Next day phoned Alder Hay and they were like, oh, his results come back. It's negative. He hasn't got it. We're like, oh, brilliant. They were like, he might just be a bit constipated. Do the bicycle legs and do a warm bath. And we were like, okay. Later through the day, getting a little bit more concerned. And then we got a phone call from one of the consultants at the hospital. And they were like, how's Teddy doing? And we were like, well, he hasn't pooed, but we have had his results. We know he's not got Hirschsprung's. And they were like, I don't know what's happened. They weren't Teddy's results. They weren't Teddy's results. Um, so they were like, we haven't had his full results back yet. But the fact that he hasn't pooed, they were like, we want you to come back. So we went back. That just straight away left, dropped my daughter off with my dad and got there. And it was a very different conversation. It was like, we don't know, exactly the extent, but we think, yes, he has got, I can't remember the ins and outs, but I think they take a certain measurement, don't they? And say the initial measurement, they couldn't find the cells or mixed cells. And that kind of started the journey, really. They told us kind of the next day they'd had the full results back, and there was positive signs at that point because he had been pooing by himself intermittently. He wasn't a typical kind of case, and they suspected short segment, but yeah, that was kind of the confirmation, really, a bit of a roller coaster to get there. And I suppose just a little bit of relief to have an answer or to have an understanding. A little bit of confusion initially. So, okay, he's going to have the surgery, but then he'll be okay. Well, no, he'll always have it. And, I think it takes a little bit to kind of get your head around. But ultimately, we were sent home, 3 washouts a day, come back if there's any issues. And, we were really lucky. We did, the washouts are awful for anybody that has to come home and do that. It is, something that you would never have to think that you'd have to do to your child. They're so tiny. And I remember kind of the first couple were, really upsetting, really traumatic. I used to dread them, but actually, in a weird way, we came to like, I don't think enjoy them is the right word, but like just be like, oh yeah, that's a good one. And we would just feel like, yeah, we were doing such a good thing for him and he'd always be so happy. And, it felt like, we got very used to it. And yeah, we did that right up until his surgery, really. It was 2.5 months old when he had that. So, and they found out, yeah, it was a short segment while he was in surgery.
Yeah. Wow. I mean, even though it's not necessarily a typical diagnosis, there are still parts in there that I think anybody who's had a child with Hirschsprung's would certainly recognize. With the whole sort of, yes, he did poo initially, but then everything kind of stopped, and then there was the sort of I think the slow to feed is always a massive, massive one.
Yeah,
I know that's a big red flag for a lot of people. Like when you said where the milk goes down the tube and then comes back up and then goes out and then comes back up. I think that's sort of a classic one, but really, really interesting to hear as to possibly why the hospital didn't think he had Hirschsprung's, because again, it's a specialist place for Hirschsprung's,
yeah,
and so they've presumably heard of it, treated many, many children with this condition, and yet still, I think it's still kind of presenting the classic symptoms. I think it's also interesting, whose results did you get? I
yeah.
mean, I doubt if it wasn't Teddy's results, whose results were you being told?
I know, and it's we don't harbour any kind of resentment. Old Hay's an amazing
No.
place, and we had
Yeah.
amazing care there. But yeah, it was a bit of a shock to be told, oh no, and we didn't know much about it at the time. But that could have been quite devastating to be like, oh, thank God, like it's not that, and then oh, actually, that they weren't your results. But I think, the neonatal unit that we were on, I'm sure it had like maybe 5 beds or 6 beds. And there must have been another child undergoing very similar, kind of investigations who clearly doesn't have Hirschsprung's disease.
No, no.
Because we got those positive results. Um, but yeah, I think that initially not knowing much about it, it was more of a relief when we found out he had it because there's, you know, there's lots of awful things that it could have been at the time, when we were told there was masses and shadows and all sorts, in that area. Um, but I suppose, yeah, we just didn't know what that journey was going to look like, I suppose.
No. And when, because again, I've heard this before as well, when they say don't Google Hirschsprungs, don't search it, don't whatever. Did you take their advice and not Google it, or did you Google
I
it?
mean, it was pretty hard because to spell it in the first place, I was like, huh, what, like, what is this? Kind of Google. Um, but I think we did initially. I was a bit like, I don't know, I just kind of closed off a little bit. I was a little bit scared what I might find. Very briefly looked at it when they mentioned it, but I think as many parents probably start off initially before you realize that you have to become, medical yourself really and kind of advocate a bit more for your child. And the doctors don't always know better than you. Initially, certainly we felt that, we just kind of believed everything they said and just thought, not that they were, obviously, they were going off what they thought at the time, but um, when I did look into it very briefly, I think you always see the worst case scenario and the horror stories. And um, yeah, I wasn't sure whether he would eat normally, whether he would, what that would look like. Would he, have a, stoma or, colostomy or whatever kind of his future looked like. It wasn't very clear. I think that, there is a big spectrum, as we've like said before, in terms of the disease. But I think that's something that we found straight away was a bit like go away and see how you get on. And if you come across problems, then we can help. We've got nutritionists and we've got doctors and we've got gastro and all this kind of stuff. Whereas, you know, he had his pull through surgery. It was short segment. He was doing really well. And we got sent home, told about enterocolitis. And we were a bit like, okay, when we left, we asked the doctor, same doctor actually, who told us he didn't think it was Hirschsprung's. And we said, what's what to look out for French colitis, and he was like, it's really rare. Like, don't really what like don't worry, don't worry about it. We were like, oh, okay. We thought it was like a given that he would probably get it, multiple times. And he was like, no, no, it's quite rare, just if he ever, everybody's different. Because we were like, well, what to look for? Should he go X amount of times a day? Should it look like this? And it's like, everybody's different, like just see how you get on. And we were kind of sent home post pull through, don't have to do washouts anymore, don't have to do this anymore, see how you get on. And it was a bit rocky at that point. He would get very distended. And even though he was, going to the toilet, but God, I've got whole albums on my phone of like various points of, his tummy, and it looked like this and it looked like that. Um, we ended up in hospital twice, going back once because he started vomiting again, but it was clear he was just backed up. He wasn't poorly, he wasn't presenting. And as soon as they did a washout in hospital, again, fine, eating, not being sick again. And then the second time we went back with his distension, a nurse said, are you doing dilations? And we were like, what what's a dilation? Like, no. um and she taught us to do the kind of, the dilations to help kind of relieve anything else if there's anything, kind of building up. And that was a game changer for us. We would do that if his tummy looked bad, it would help him, pass wind or go to the toilet maybe a little bit. And that kept us out of hospital. We kind of weaned him off that. And touch wood, because he's only 3, we've had a relatively easy ride of it compared to most people. Awful, traumatic, horrific, probably still a little bit damaged from that first couple of months, 6 months to a year certainly. But I remember saying to his consultant in the hospital, I just wish we could like fast forward 2 years or something so I can know what we're dealing with, like how he's going to fight, be. And he was like, don't wish his life away. He was like, you'll work it out, you'll be okay. And he was right. I think that for us, just the future and with it being so uncertain and not really knowing what we might come up across was scary. But actually, you I think for any parents that are maybe new to this or like younger than Teddy, you really, it's so scary in the beginning. You teach yourself though, you become very aware, you will learn what's normal for them, what works for them, and how to, look after them. And it does get easier. It really does. But yeah, it was definitely scary, but I feel like again, always touch wood, we're in a an okay phase. But that's not to say that we won't have issues, in the future, because as we know, it doesn't go away post surgery.
Yeah, you're right. I mean, everybody is different, which is why it makes it so, so difficult to say anything with any definitive outcomes. Like we were talking about before with things like Facebook groups and Instagram posts and whatnot. And you see all manner of, in inverted commas, advice
Mm,
about you should try this, eat this, don't eat this, do this exercise, do this type of washout. And I think all of those are meant with the best intentions,
yeah,
but everybody is different. So it's really, and that's why it's so difficult because it's a lot of trial and error, I presume,
yeah,
and a lot of finding out what works for you, which I guess is the really, really difficult bit. And I'll sort of go back a bit on what you said about parental instinct. And it's not just the initial diagnosis. I mean, I know that thankfully you trusted your instincts and you knew something was wrong, and thankfully, got Teddy the diagnosis he needed. But then I guess you're also using the same instinct for everything else in terms of what
yeah,
works, what doesn't. Is that the case as well?
yeah, absolutely. I think you know, you just come to know them. I think, as I say, we've been lucky. There's not really anything that we've ever noticed in terms of his diet or anything, but when we started weaning from 6 months, he'd been exclusively breastfed. Um, I'd undergone all sorts of things, removing elements of my diet. Can we try and remove some of this gas? No dairy, no gluten, all sorts of things, which didn't, necessarily make any difference. But from kind of 6 months on, that fear of starting to introduce food, and what does that look like? Because we'd been told about FODMAP and, watch Brachiosphagy maybe, and, they can't really process anything with the skin, all that kind of stuff. And I was a bit like, well, it's hard enough for an anxious parent anyway. Then we just start like bringing food into it. But even like, does he have a bit of formula or a bit of cow's milk and what that looks like? And I think we just had to take things, little by little. Um, we were always really scared of, certain illnesses and, worried that he would be kind of poorlier, quicker. Um, but I think over time we've just realised you, you have to just take everything as it comes and just to see, try it if that doesn't work, or if he's, particularly, doesn't take that very well. Because we would ask, what about probiotics? And we'd go a bit like, not really any evidence, or other things that we would ask, and try and get, well, should we be doing this? And it was always a bit like, maybe try it. If it works, then great. If it doesn't, then it doesn't. It's a bit like we've had to teach ourselves. I'm sure every parent in that space. And to your point, there's such a wide spectrum of in terms of case by case, and each child is different. So I think trusting your gut, and especially kind of, I suppose, with weaning, we were just really careful not to just introduce loads of things at once. We could maybe figure out like, that doesn't work, or maybe that's caused, this. Um, but yeah, over time, and here's, 3 here before this year, we've just found that there's nothing specific that doesn't work for him. So you just have to treat him as a normal, when we've got an 8-year-old, so treat him as normal as possible and, and see how you get on really. I think for us, we get to see, somebody at Alder Hey once a year, and then we just go, they weigh him and they go, is he okay? Yeah, he's fine. He's been fine. We've been lucky with him with potty training. He's potty trained really well, which we were told, oh, there may be a little bit of a delay with, potty training, but yeah, I think every child is different. And I suppose you just got to take your own journey, take the advice as it comes, and listen to people like yourselves and like Georgina doing the website and the support that is there now. It wasn't really there when we came into this kind of space, but everybody's got their own journey, right? You've just got to kind of muddle through with a bit of support here and there and see
Yeah,
what works best for your
yeah,
baby or for you or whoever's kind of dealing with it.
yeah. I think so. I think, and it's so difficult to give those sort of vague terms because everybody wants, and I think quite rightly, I think everybody wants definitive. Everybody wants do this, don't do that. Okay, cool,
Yeah.
lovely. And Hirschsprung's doesn't work that way,
No.
and never never has done. I mean, again, I meet so many people with so many different, um, whether it be diets, whether it be symptoms in terms of, this doing this particular thing doesn't work, but doing this does. It's interesting you say about the probiotics as well, because that's something that I was told many, many years ago. About make sure you have, things like Yakults and probiotic drinks and this, that, the other, which again makes total sense because they're what's it, good stomach bacteria or something or other.
Yeah, good for the gut.
So again, that would make sense to drink those, but it's interesting. It'd be really interesting to know, I think, how much of an effect they have. I don't know if there's any studies. I've got no idea how
Yeah.
much of an effect they have specifically on people with Hirschsprungs, because I again, sounds reasonable that they would work, but whether they actually do, I'm not sure.
I think there's a massive piece around gut health, which again is not really explored because people say like your gut is your second brain, right? And everyone else day
Yeah,
to day is like, look after your gut, like you say. But and we noticed with Teddy, he had quite bad eczema as well when he was younger, kind of bad skin, which can be related to kind of gut health and all that kind of stuff, which, it's not a family trait. My daughter doesn't have it. And also he was really sickly, in the first couple of years, which kids are when they go to nursery. But we noticed that he would just pick things up, quicker, not necessarily have them worse, to be honest. We've just had chicken pox in the house and he had it very briefly over a couple of days, very minor, and then my 8-year-old caught it and just had it, horrendously. So actually, in terms of immunity, not, you know, he's quite strong in that sense, but he would pick up everything, and I'd just be like going to the doctors, like, is it his gut health? Like he's got a gut issue. Must be there must be some connection. They'd be a bit like, I don't know, I don't know, So I'd be standing there in Holland and Barrett looking at these child, prebiotics and what's the difference between a prebiotic and a probiotic, and trying all these things, and it was a bit like, well, nobody's really looked at it. To your point, there's no research done, so try it. If it works, great. If it doesn't, then as with anything, it's just like a trial and error, isn't it? Like, okay, well, we'll try that. Or what I have found with him, maybe it could be a coincidence, is just being really strong on the vitamins, just from an immunity like perspective. As any parent trying to get vitamins in your child, but we're quite consistent, with his vitamins. And on the whole, yeah, he's healthy and fit. But I would be really interested, yeah, to see what that kind of, if there is a positive, because again, on the Facebook groups, people have been advised from their medical professionals to try certain things. So, um, yeah, again, just like I suppose the scope of the disease, the scope of the care or the kind of advice and or the awareness is very different as well.
yeah,
Um, which is why any kind of research project or anything, I'm always like, yeah, like give us like well let us put like plow as much information as possible so we can start seeing the findings of things like this that
Yeah,
make a difference.
absolutely. And I think that's an interesting point you made about gut health. And there's a lot of research done between gut health and brain health, mental
Yeah,
health. And I think that's something that I've been really interested in these sort of past couple of years and with people I talk to, and how having potentially stomach issues or pain within the stomach can really affect the brain. And
really.
there's a lot of studies within that that show there's a big link between the two, which I find fascinating. So I think that's something that I think, and again, whether that's, I'm not sure that's specifically Hirschsprung's. That could just be stomach issues. So it could be anybody with
Yeah,
like IBD, IBS, Crohn's, whatever.
yeah,
Um, they could potentially have sort of that, be susceptible as well to more issues. But I think that's something that is really, really interesting. And I think as time goes on, we'll probably start to hear a bit more on that kind of research, I think.
yeah. I think that will, can make massive changes to people's quality of life and stuff as well, can't it? If that's, I think, yeah, there's a massive key piece. It's like a missing part of the puzzle, isn't it?
Yeah. Yeah, I think so. And I think it's a tricky one. It's a really tricky one because it's one of those things where, you know, if like you were talking about with Hirschsprung's symptoms, either via an X-ray or just by looking at someone, you can see Hirschsprung's symptoms. Like you talked about the distended stomach,
Mm.
or if you do an X-ray and you can see that there's a blockage, you can see that there's a physical issue.
Yeah,
Whereas the link between gut health and brain health is a lot trickier because you can't necessarily see it. I think.
no, absolutely.
I think
Absolutely.
that's possibly a big issue as well. But I also really like stories like this because, like you said, trying to or wanting to fast forward the first couple of years,
Yeah,
um, I think is a really really common story that I hear, and
yeah.
it's it's interesting because people talk to me about Hirschsprung's and say, "Oh, it's a childhood condition,"
Mm.
which it isn't. It's you will
Yeah,
always have
yeah.
Hirschsprung's.
It's quite
So
hard to get your head around, right? Like I couldn't understand it at first. I was like, "What? If you have the surgery and you take away that bad bit, well, like it's gone. Like I don't get it. Like it's hard to get your head around it."
yeah, and I think, but even again, even medical professionals have said to parents that I've talked to, oh, and actually, I was told this as well that I had Hirschsprung's.
Oh
That I
yeah,
don't have Hirschsprung's.
yeah.
And that's what I'd said again before doing this podcast. That's what I'd said for years. I was like, oh, I had Hirschsprung's, and actually, it's like, well, and it was she's somebody I had on who is a nurse, and she said, well, it didn't grow back, so you've still got it. I was like, oh,
Mm,
yeah, of course it didn't. Actually, it
yeah.
didn't grow back. So I think it's I think it's important to know that you have it to a degree. I mean, in terms of, I know Teddy's only 3, but what's his kind of understanding of his own condition?
I don't think it's got any really. I think the only time it's really in our day-to-day life, we are obsessed in this house with poo. Like you just
Yeah,
are all the time. And like between me and my husband are like, has he pooed today? And he'd be like, no, I haven't cleaned one. Have you cleaned one? I'm like, no. And then okay, okay. And he'll never really, it'll have to, we've got to the point now where you can go a day, like a 24 hours, and we'd be like, okay, just he needs to go today, like before we start to panic. That's never happened that he's gone longer than 24 hours. Maybe, I'm sure if we phoned on to him, they'd be like, is he well?
yeah,
Just wait, like he'd be like he'd be fine. So we're still, obsessed with that. And even, I say he's potty trained, we still have to like keep the potty around for us. He goes to school in the morning, he goes to a play group in the afternoon. So for us, we need to make sure he goes in the morning for it to be, a smooth day, shall we say, and make sure there's no like, no accident, no accident, make sure. And so him having that in the morning to sit as a visual thing to be like, he probably, when we've removed it and stuff in the past, he doesn't think about it. He won't necessarily go, oh, I'll leave the lounge where my breakfast is and the telly is and go to the toilet. And so in terms of his day to day, there's nothing. He doesn't have to have any kind of care plans or anything with school. I still, write it all on the forms, and then you usually feel like you have to give like a war and peace of it's a bowel condition. It may mean X, Y, Z, things to watch out for, things to tell us about, that kind of thing. But in terms of day to day, no, not really. I do wonder what that would, at what point we will have that kind of conversation with him. And I think that, I said to you kind of in the prep for this, our big focus now is the genetics of it because I find it my responsibility to, he's 3. So this is like 25 years in the future ish, maybe if and when he decides to have a family. But I want to be able to come with him with everything of what that looks like for him, because that's probably when unless again, touch wood, there may be stumbling blocks, in between then. But for me at the minute, that's what does that look like for him and his future with procreation. What I want him to be. I don't want him to go, well, I don't know if I'm worried about having a baby because I don't know whether my baby will be really poorly and will I pass something on, or I want him to be fully informed at that point that this is what that will look like. And God, science, we hope, will be so far ahead in 25 plus years time or whatever that looks like. But if it means that he need, at the minute he's only going to be able to have reps testing as everybody can, and we're kind of in the process of that. So our local authority made has got in touch, and we've kind of sent the initial forms and stuff. But me and my husband, when we were talking about this today, last night we were saying, well, what does that look like actually when it comes back, whether it says yes, you have got a defective Rett gene, okay, but what if you haven't? There's other genes that could be at play. There's other reasons, so then when do we stop, or what is kind of next for us? So I think for his future really, or that's probably going to be when he really gets an awareness of it, in terms of what does that mean? Because it's genetic. We don't know where the genetics have come from because as far as we're aware, there's no family history. And it was one of the questions in the hospital. They said, have you got any other children? And I said, yeah, I've got a daughter. And so I've got an older child. And he was like, is it a girl or boy? And I was like, girl. And they're like, oh yeah, rarer in girls. And I was like, oh, but does that mean she carries the gene or doesn't? It's still, there's a bit of a kind of, it doesn't really matter if it came from me or my husband's side, it doesn't matter. We're not going to have any more children in that respect in terms of, our family's complete anyway. But then for our children, what does that mean? Because we've been lucky with Teddy so far, but we want them to have a full eyes wide open when they go into, the future, what that looks like for them.
Absolutely. And I think I could talk about genetics all day. I find it absolutely fascinating. And I think the really difficult bit is that, again, like we said before, there's a lot of vague answers. There's no clear, oh, it came from here, so therefore it's got X amount of percentage to be passed on from here to here to here, or whatever.
Yeah.
But I mean, again, talking to as many people I've had, I think I've had every type of scenario where, people have had more children and they haven't had the condition, where the parents had the condition but they haven't passed it on to their children, where the girl has it but the boy doesn't, where the boy has it and the girl doesn't. I
Yeah.
think it's every time somebody said to me, well, it's passed through this and this will happen, I've said, well, actually, I've got an example where that hasn't happened. So
Yeah.
it's,
Actually.
yeah, it is. It just, it's so tricky. So any information that can be passed on or any information that we can know definitively with
Yeah.
genetics, and I think the next decade will be really, really interesting because there's so much going on at the moment in terms of
Yeah.
research, especially at older hay. And I think, again, by the time Teddy's in his sort of teens, I think will be really, really interesting to see where we are.
Yeah. That's exciting because I think that that just feels like that next like duty like for him. I don't want him to ever, worry about it. He's got, very tiny little scars on his tummy that maybe one day he might go, what's that? What's that? Or we'll talk and we'll say, when you were poorly or, when you were in hospital. He's got no kind of recollection. Um, my poor daughter has, at 5, she was kind of very aware of that. And we bought the book, gosh, I can't remember the name of it now. But it's a brilliant kids book that I'm sure you'll have seen. That was made by a mum whose little boy had Hirschsprungs, and it's like a picture book. And actually, sometimes I've used it for like play group to be like, I know it's a children's book, but it gives you a very just top line info of what it is, what it could look like, what the issues are. And so we've got that, and it's in his room, and we've read it before, but I don't think he's made that connection of, oh, I've got that, or
Yeah.
you know. So yeah, so I don't know what part that will play in his future. Again, I hope, not a lot, just something, a bit of in the past. But yeah, there's definitely when it comes to, family for him, I think that's gonna, well, it would be, wouldn't it, if you knew that you had something you would want to know what that looks like so that you could just prepare for it, at least. Um, but yeah, so we'll see where that goes.
Absolutely. But no, thank you so, so much for coming on and sharing Teddy's story. And I think it's really important to have these kind of positive stories as well, where yes, obviously there was, very difficult at the beginning, but it's great to hear that he's doing so well and living essentially a normal,
Yeah,
as normal could
yeah,
be,
yeah,
in
absolutely.
inverted commas,
Yeah.
life. But thank you, and obviously I wish you and your whole family and Teddy all the very, very best for the future.
Well, thank you. And thank you to you again, people like you and like Georgina and stuff that we've mentioned that massive make a massive difference to new parents going through this. Just having, someone to talk to sometimes, or just good resources, or, just a bit of scope. Because as we touched on when we came into this journey not that long ago, it was like hardly any info and you kind of have to muddle through, or you see the worst case scenario and it's traumatic anyway. So yeah, thank you for doing this because it's going to help so many people.
Oh, my pleasure.